Mr. Floor Leader.
Thank you, Mr. Speaker. Please recognize Representative Talley to present House Bill 3073.
Clerk will read.
House Bill 3073 by Talley of the House and Rader of the Senate, an act relating to public health and safety.
Representative Talley, you're recognized to explain the bill.
Thank you, Mr. Speaker. This is a bill from one of my members back in Cushing. It adds and defines palliative care into law, and then it also gives exemptions for overly burdensome requirements for the management of sickle cell anemia. Move to pass and stand for questions.
Representative Gann, you're recognized for a question on the bill.
Thank you, Mr. Speaker. Representative, palliative care is something that's already done by people in the healthcare community. That's just treatment for end-of-life care. It sounds pretty harmless, but why are we changing? Why is it necessary to add to the definition of palliative care in this bill?
Thank you for the question. I'm told that a good definition's not in law, and this just makes it a better definition. That's what I'm told.
Representative Gann, you need a follow-up?
I'm sorry.
You're recognized for a follow-up.
Thank you. So if it's already, why does it have to be in statute?
Because doctors are afraid to actually help people that need palliative care, and this will help them do that.
You're recognized for another follow-up.
Yes, and we want the healthcare community to feel free to deliver that care however they see fit based upon the doctor's directive. But what I'm concerned about is the expansion of the definition, especially in relation to what's happened nationally with H.R. 1, the Build Back Better plan by Biden, who seem to have included a different definition of palliative care. And so I'm concerned about the choice of, or the words here about choice of care and quality of life. Can you address, and do you see a potential harm in expanding that definition?
Thank you for the question. Several doctors and people a lot smarter than me in the medicine field are the ones that came up with what we should put in this.
Representative Gann for a follow-up.
What I'm concerned about is the Texas Pro-Life have marked bills that expand the definition of palliative care to be cautioned, and because of the abuse that palliative care services can have by expansion of that definition, especially in the use of palliative care by doulas and Planned Parenthood. So did you research, were you able to find any information on H.R. 1 and what the Democrats are trying to do with that bill through palliative care definitions?
Thank you for the question. No.
Representative LePack, you're recognized for a question on the bill.
Thank you, Mr. Speaker. Representative, I'm sorry I did not visit with you about this ahead of time. I've had two parents that spent a lot of time in a hospital here in Northwest Oklahoma City in the palliative care wing of the hospital. And this is a wing specifically set up to care for those end-of-life issues. Very difficult situation for family members. But my question is why this is similar to Representative Gann's, why this is needed when hospitals have entire wings or rooms prepared for this. Doctors that were visiting were actually encouraging us to take advantage of those services. And you're right, whether hospice is involved or not. So I'm struggling with why doctors think they need this protection.
That's just thank you for the question. That's just what I was told, especially in rural Oklahoma, doctors would feel if they had more protection.
Representative LePack, you're recognized for a follow-up.
Does this definition expand palliative care beyond the end of life situations people get into? Is this intended to deal with chronic pain, you know?
Yes,
'cause you can,
it does. Thank you.
Representative Robert Shaw, you're recognized for a question on the bill.
Thank you, Mr. Speaker. You mentioned that someone from your district requested it. Could you go into more of their background and what their intent is behind this bill?
Yes, sir. Thank you for the question. This lady represents a lot of people, but especially herself, struggling with pain her whole life. And a lot of rural doctors are just scared to help people, and so they wanted this definition in there.
Representative Randleman, you're recognized for a question on the bill.
Thank you, Speaker. I appreciate your bill. I guess I may use myself as an example of this, is that you know that I had cancer 2 years ago. And during that cancer, what we had to have is chemo. Well, when I had the chemo, it caused massive neuropathy in my feet. And so I have to take medication for that. If I didn't take the medication for that, I probably wouldn't be standing here today. But I want to share a situation with you and ask you if this is what you're talking about, is that numerous times I wrote in for the prescription to be refilled. There were days that doctor did not fill that prescription. By that time, the neuropathy was almost up to my knees. When I did get it, then it took the same amount of days to get it out, and it was miserable. My feeling is that doctor was kind of concerned here about prescribing too much. Is this what your bill is going to address, and can you address it?
Yes, sir. Thank you for the question and the observation. That's exactly what it's supposed to help.
Representative Randleman, you're recognized for a follow-up.
So this bill would actually make it where the doctor feel a little bit ease, and that he would go ahead and get the prescriptions filled right on time. Is that what you're saying?
Yes, sir. Thank you.
Representative Rowe, you're recognized for a follow-up.
Oh, no.
I'm sorry, for a question on the bill. My bad, I apologize. It can be a follow-up.
Thank you, Mr. Speaker. Representative, if I understand this bill right, you're trying to establish a difference possibly between palliative care and hospice. Is that correct?
Yes, ma'am. Thank you for the question.
You're recognized for a follow-up.
And would you agree that there are some family members and some patients that aren't quite ready to do hospice and do more of a palliative care instead of hospice? Would you agree?
Yes, ma'am. Totally. Thank you.
Representative Rowe for a follow-up.
Thank you, Mr. Speaker. So if I understand this correctly, are we trying to possibly give some protections to physicians for prescribing more pain medicine than may be normal for a palliative care patient that's not in hospice care? Is that correct?
Yes, ma'am. Thank you for the question and the observation.
Representative Goodwin, you're recognized for a question on the bill.
I noticed that it's got sickle cell added, and
Yes, ma'am.
would you agree that right now we have very few pain treatment centers that deal specifically with that disease, and there are a number of folks that are not addicted, don't seek to be addicted, they seek to have help in a crisis, and that is why that language in particular has been added to this bill to help a particular population where for decades they've not received the kind of care that they're seeking. Would you agree that's why you're running this?
Yes, ma'am. Totally. Thank you.
Representative LePack, you're recognized for a question on the bill.
Thank you, Mr. Speaker, and with your indulgence, I actually have several, and I'll keep asking as long as you let me. It sounds like, Representative, then we're trying to, if you're trying to give a doctor some additional comfort or protection here, I've never seen a doctor shy about prescribing something, about referring to another doctor. Any limitations they had might have been because of what their insurance would allow in terms of their own treatment. but it sounds like you're more concerned about the legal issue that a doctor might face. Is that true?
Thank you for the question. Yes, many doctors are nervous about prescribing, like Representative Rowe mentioned, palliative care help with opioids. So it's a serious problem.
Representative Pack for a follow-up.
Thank you for the question. And we've passed law out here about opioids and the regulations around there. So there's a lot of protection there if they align with that. But there's also ways in that bill to allow additional prescriptions. There are some requirements by the patient and the doctor to adhere to, but you can still get those drugs if need be. And so I'm still coming back to why we need this. And my suspicion, quote unquote, is really with some language called quality of life, which I'm all for, but that can be twisted into so many different things that are really not about quality of life. That's my concern, and if you care to comment, I'd appreciate it.
Yes, sir. Thank you for the question. Healthcare professionals wrote this and rewrote this, and we worked with J.C. Watts, former congressman, to help with sickle cell, to make this the best we could make it so that doctors who are nervous, who are afraid of legal ramifications would feel more comfortable.
Representative Pack for a follow-up.
Thank you for bearing with me, Mr. Speaker, Representative. So on the sickle cell issue, that is a horrible disease, and please educate us a little bit more about the services that are available because of this in this bill as opposed to what is available or not available today. The good representative from Tulsa mentioned emergency care, but we have ERs in a lot of places, so could you elaborate a little bit on that?
Yes, sir. Thank you for the question. Many doctors, I feel, don't totally believe that sickle cell is as painful and excruciating, and that's one of the reasons why Representative J.C. Watts, Congressman, got involved, because a nephew of his or a niece was suffering for this.
Representative Gann, you're recognized for a question on the bill.
Thank you, Mr. Speaker, and thank you for your patience.
Yes, sir.
I just am curious if palliative care and hospice care need to be defined. Why do we not expand what hospice means in the bill? If we're trying to separate the two, wouldn't we have two different definitions of different things?
Thank you for the question. That makes sense, but most doctors, when they decide you're dying like very soon, you can take as many, aspirin, opioids, anything. But the palliative care, you're not necessarily dying quickly, and so you need pain, like Dr. Randleman was saying. You need the help right then.
Representative for a follow-up.
Thank you, Mr. Speaker. And my final question, if we don't define what hospice is along with this expanded definition of palliative care, then don't we blur the lines between the two, and we could spill over into without trying to treat the patients for like pain management things, we get into end-of-life issues and speed that up. Do you see a concern with that?
Thank you for the question. No, sir, I don't.
Representative Blancett, you're recognized for a question on the bill.
Thank you, Mr. Speaker. Representative, would you agree that in today's society we are highly litigious, and that has put the medical community in between a rock and a hard place, and as a result, the liability insurance that physicians have to now pay for has skyrocketed because of that litigious environment? And so would you agree that what you're doing is helping that environment by further defining the legal parameters by which a physician can help a patient in suffering?
Yes, ma'am. Thank you for your observation. That's exactly what I'm trying to do.
Representative Randleman, you're recognized for a question on the bill.
Thank you, Mr. Speaker. Would you agree that last year we came into the House and we did pass legislation to protect the overuse of opioids and everything like that? Is that correct?
Yes, sir. Thank you.
Representative Randleman, you're recognized for a follow-up.
Would you also agree that we did not address the people who needed the pain medication, that there would be a problem with them getting that medication?
Yes, sir. Thank you for the question. Yes.
Representative Randleman for a follow-up.
Wouldn't you think that it would be, since we've actually protected the people from using it too much, don't you think it would be a good policy for us to come in and make it where the people that need it truly get it?
Yes, sir. That's exactly what I'm trying to do. Thank you.
Representative Goodwin, recognized for a question on the bill.
Thank you. And would you agree that cancer was already law, so that's already covered, and doctors and nurses and mothers and fathers of folks that have to deal with sickle cell, which would you agree, do not have a lot of folks that specialize specifically in that, not only in Oklahoma City, not only in Tulsa, but in Cushing and Ardmore, et cetera. Would you agree that this bill, the acute chronic pain and crisis that will occur suddenly, 2 o'clock in the morning, where this had been offered years prior for care, and then was stripped away, and we have a lot of folks out there simply suffering, and that this bill would actually help folks that are suffering with acute pain. They're not trying to be drug addicts. They're simply trying to use available meds that can help.
Yes, ma'am. That's exactly what I'm trying to do. Thank you.
Representative Talley now moves that House Bill 3073 be advanced from general order. Without objection, that will be the order. Third reading of the bill.
House Bill 3073 by Talley of the House and Raider of the Senate, an act relating to public health and safety.
Representative Talley now moves final passage of the bill. Will there be debate? Seeing no debate, the question before the House is, shall the bill pass? Clerk will activate the cues. Sergeants announce roll call in the hall. The roll call is now in progress. Yeah, thank you. Kennedy, aye. Roberts, Eric, aye. Bennett, aye. Newton, aye. Townley, aye. Miller, aye. Russ, aye. Stiegel, aye. Members wishing to vote or change your vote, chair is preparing to close. Declare the vote.
69 aye, 16 nay.
Having received a majority vote of those elected to and constituting the House, I declare the bill to have passed. Representative Talley now moves that the vote on the bill be the vote on the emergency. Without objection, that will be the order. Declare the vote.
69 aye, 16 nay.
Having received a two-thirds vote of those elected to and constituting the House, I declare the emergency to have passed. Mr. Forlair.